Welcome to the Being in Medicine show. I'm Corey Anderson.
And I'm Jeff Mars.
Together, we aim to revolutionize the healthcare experience for patients, clinicians, and all team members by unlocking the transformative power of human potential.
Each week, we explore with you and our guests how embracing our authentic selves and choosing who we are being can affect the nature of healing, leading to profound transformations in our lives and in the lives of those around us.
Join us today on a journey through self-discovery and empowerment as we unlock the human potential within each of us. Welcome to Being in Medicine, the podcast where we explore the deeper side of healing, mind, body, and spirit. Today's conversation is all about reimagining what leadership in medicine can be. Our guest is Dr. Cathleen Peterson-Layne, board-certified anesthesiologist, professor, and founder of Being Incredible. After 25 years in academic medicine, she made the radical decision to step away, not out of delusionment, but out of deep belief in what the healthcare could become. She now works with the healthcare leaders to spark lasting culture change, help teams soar, and not settle. And here's a unique fact. She's not just a physician. She's also a pharmacist and a PhD in neuropharmacology, blending science, empathy, and vision in everything she does. Dr. Peterson-Layne is here to show us that we don't have to choose between excellence and fulfillment. We can lead through both. Dr. Cathleen, welcome to the show. We're happy to have you.
Thank you so much. Appreciate being here.
Yeah. Well, man, it is a wonderful time to have you join us. And you have such a unique background between pharmacy and PhD and medicine and academics and all of the things. And then to step away from that to explore being incredible through leadership. Tell us how that journey came about.
Well, each of the steps of the journey seemed like the right step at the time. When I finished up pharmacy school in 1988, then went on to graduate school because I knew there was more. I really enjoyed the idea of figuring out how the world works and digging deep into that and how mechanisms are and asking those crucial questions. I recognized at that point for me, I missed people. I needed to be with patient care. So then I made the decision to go back to my original, dream A and go to medical school, became an anesthesiologist, loving the learning, loving the teaching. So I've spent almost 25 years in academic medicine, practicing medicine, high acuity, obstetric anesthesiology, teaching residents, teaching nurses, teaching my colleagues locally and nationally. And then I recognized that something was missing. I finally recognized it myself, and I saw it around in my colleagues that yes, we were achieving lots of stuff, doing lots of stuff, great things, excellent achievements, but there was this hole, and there's this frustration around that there must be more, and that it wasn't like things were so hard that there wasn't the power to change. And that's why I decided to step away from working in a single institution and a single profession for that matter, to have a greater, more global impact on leaders in healthcare so that we can be more as individuals and thus be more as systems, even institutions, and as a profession.
Wow, that took remarkable courage to step away from a career as accomplished as that. So tell us a little bit about what you do now with the leadership. How does that transpired?
Yeah, so I work with folks individually as well as with teams within organizations to help them see how they can be different, right? How they can accomplish more by looking, examining what's holding them back. What are their, we tried that and it didn't work. Well, what did you try? What didn't work? What are the barriers standing in the way of actually accomplishing the goals that they want to? I've started to recognize that sometimes what we do with really good intention as organizations to measure our quality may actually be impairing our quality.
Oh, interesting.
And one example of that would be actually in the peri-op space that I know that Dr. Mars and you work in, all three of us work in, and some of our audience members may too. We work at first case on time starts, FCOTS, our beloved FCOTS. We've been doing it for 20 years. So simple, right?
Yeah.
And it's just first time on time start, getting that first patient into the operating room on time. In my practice, it's typically been 7:30 in the morning. Simple. I've always taken it to represent that a good team, a well-coordinated team can accomplish that.
Yeah.
However, in operation, what I've seen in working in several institutions and different sites within the institutions, that rather than representing good teamwork, it can often be used in a way that when it fails, that sometimes it can be used by leadership, and leadership being any level, being boots on the ground all the way up to CEO, can be used by leadership in a way to blame and shame, and actually have the opposite effect on the team.
Yeah.
So our well-intentioned metrics may be hurting what our real goal is, and can get us off of, maybe getting us off in some circumstances, off of what our real goal is.
Yeah. So you work with teams to change in which how they practice and lead through those particular spaces. Yeah.
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 So when you were practicing, let's go back to when you were practicing medicine, and you talked a little bit about the frustration. What brought you to this movement, to changing how you show up in medicine? What was that like when you were working through the frustration and came into this understanding that, man, we can show up differently in medicine? What was that experience like?
Well, I think it's more reflective, right? Because at the time,
Sure.
it wasn't just to say one single aha, but more reflective, and then looking around, some pressures that came to me in my job, and looking around and going, we can do different.
Yeah.
One experience that reflecting, looking back on, is that where I could have shown up differently is,
Yeah.
I don't know if you've ever had that day where you go into work and you work for 15 hours, which in our business you can, and you
Yeah.
kind of go, wow, okay, it's time. Maybe it's time to eat. Maybe even time to go home, right?
Yeah.
In contrast, there are other days when I would go into work, and within 15 minutes, I'm like, when do I get to go home?
Right.
Same circumstances, same coworkers, same everything. What was different though was me.
Right.
How was I showing up on those days? And when I started to reflect on that maybe my tough circumstances, maybe, I can't change, I can't change everything. Yes, there
Right.
are things in medicine, arguably, that would value from being changed. But what I recognized, that I saw so many of my colleagues, I see some of my colleagues now, who have just sort of, if they haven't resigned and walked away,
Yeah.
there are many people who have just like, well, I'm just going to put in my time, just going to do my job. And I know for me, when I do that, when I just go in and just to do my job, I don't do my best work.
Right.
But when I show up whole and ready to just totally serve my team and my patients and myself, that I show up, and I'm a better physician for that. And I'm better, and my patients respond. My patients' families respond differently to me. And I know I'm providing better care when I do that.
Yeah.
And I want to support others to recognize where they do have the power to be different than they are now.
Yeah. Yeah. That's important. Showing up and recognizing how you're showing up, right? To care for others. Yeah. So have you worked with others in the leadership world or fellow physicians to help them create that awareness? Has there been a demonstration of that, or how have those around you responded to you showing up different?
Yes, there is a difference. And I'd like to say, I don't waver in how I show up. I do.
Sure.
It's always an ongoing consciousness of it, but it is different as far as how physicians, it's really what the response I get is that kind of a curiosity, right?
Yeah.
And how can they, I get approached with, how can they, sort of approach this differently? How can they be happy? One misunderstanding I get is I have colleagues who come to me like, well, I can't afford to quit my job. My goodness, that is exactly the message I want. That's not the message. Yes,
Yeah.
I quit my job in order to facilitate my work for others.
Right.
Because I see that by not being in a single institution, I don't have that removes from me any conflict of interest.
Sure.
I can have confidential conversations without there being any fears of me, any information that might be proprietary or that sort of thing. We're worried about, I'm going to use it, get that sort of thing. There's nobody to tell it to. It's completely confidential. And therefore, that to support those relationships.
Yeah, that's brilliant. That's great. Jeff, do you have any insight there?
I don't have insight, but I have a question.
Absolutely.
You expressed how you would show up to work, same circumstances, and one day would be effectively a day in flow, another one would be a day of like, well, I don't even want to be here. Yeah. And then you had an enlightenment or an awareness like, wow, I'm the one that can make the change. I can change the way I'm showing up. And then later you said, I don't waver in how I'm showing up. I could use how I'm showing up as a loose synonym for being. So if you show up being the same Kathleen, no matter what the set of circumstances, how did you create that? What process did you go through to create the Kathleen that never wavers and how she shows up?
Well, I would say I do waver at times, but that's why it's an ongoing process of noticing. And I really became more conscious of the fact of the idea of being and how I'm being. I didn't have that awareness when I was in my full-time academic practice.
Right.
I didn't have that. So it's been since I stepped back that's been a lot of my journey is exploring. It's like after I quit my full-time job, I've spent time exploring what can be different. There's got to be something we can do different as leaders. And when I say leaders, I'm talking everybody on the team, everyone who contributes to the care, because we're all leaders. We're all influencers, whether we have as I say, we have a title or not, we're leaders.
Absolutely.
But going back to your question, as far as how it's like that, it's what results do I want? And I can take actions, but there's different ways, there's different places I can come from in order to get that same action or result. That first on time start, I can do it by cracking the whip on others or myself, or I can do it by, how can I help you? How can I help you? What can I do? And showing up, I'm an early bird, anesthesiologist or early birds. We get there long before anybody knows that we're there. But but being not just efficient, it's not just enough about it being efficient. And it's about, sometimes it's about grace too, right? So when I say I don't get the patient, maybe it's my fault I didn't get the patient, as using that example. I don't get the patient on time, but you know what? I did my best to get that IV in, and I had that great rapport with that patient. And I did what, I had that allow the last minute family member visit, or whatever it is that then as a whole, looks at it as a whole and not just a one point on the metric.
Thank you.
Yeah, that's great. So if we're engaging with folks, if some of our listeners are they're practicing, they're in the hustle and the bustle, they're busy, right? How do we communicate to them how showing up, who you are being has an impact around you, and how do you demonstrate that, or how do you communicate that well enough so someone can say, oh man, I should really be thoughtful about how I'm showing up here? What does the outcome look like for people?
Yeah, the outcome looks like having a fulfilled life, having joy. And it's not about, and that joy translates over. It's not just joy at work. It's joy in your life. Yeah. That's what it comes down to. Because I personally sort of take a sidetrack here for a second, Corey, is that I think that what we've propagated, especially women in medicine particularly, we look at this work-life balance. And it's like this tension. It's like there's work and there's life, and you got to balance them. And you can't, it takes a lot of energy, right?
Yes.
You start looking at life as a whole, and then you have work as part of that, and you take your whole life, you get to decide. There's some times when you're working to become, when you're working for that professional advancement, a special project, maybe work takes a little bit more. Right. When your child's young, maybe that family takes this part of that bubble within your whole sphere of life takes a little bit more. And we get I think one of the key things is that it's a choice.
Right. Choice.
We get to choose, not just within that, what part of our life is more expansive time. But as I walk down the corridor, from the parking garage to the hospital, I get to choose who shows up that day.
Yeah.
I get to choose how I'm going to be with my patient, how I'm going to be with my surgeon, how am I going to, when I go into the boardroom for a meeting. We get to decide that. I think one of the things to notice, I found is an important, and it's sort of not really talked about in medicine, right? Is my emotions. How do I feel?
Yeah.
I've often heard and been told, we don't take our emotions to work, right? We are very cognitive. We're
Yes.
supposed to work here,
Right.
right? Don't you leave this, but we never leave it. When we say we don't bring emotions to work, we're
Right.
just ignoring them.
Right.
And we can
Absolutely.
bring positive emotions or we can bring negative emotions.
Yes.
The important thing that I've learned to do is to notice them.
Yeah.
And I think back of those times that I went in for a meeting or I was sitting in the meeting and I got that pit in my stomach,
Yeah.
but you just ignore it. And you're like, okay, you think about, what's in the agenda, what's the conversation, right?
Yeah.
So I think
Absolutely.
those are some opportunities for folks as a way of noticing, because that and I mentioned emotions relative to being. It's like when we when we notice our emotions, what am I thinking that's causing me to feel that way?
Yeah.
That's causing me then to be a certain way.
Mm-hmm.
And those are the simple things, because they're right where with us, right? Our body's right there with us. We can feel it. We can feel the elation or we can feel that heaviness.
Absolutely. Yeah. And that then translates to everyone around us, right? And we then walk into that patient room. And how have you seen that the change in the patient care just
So
by who you're being?
yeah. So I
Yeah.
can say that I've been doing some part-time, some locums work in the last few years.
Yeah.
One, because I love anesthesia, I love patient care, and to keep up my credentials, of course.
Yeah, of
But I
course.
do find that when I'm interacting with patients, I am more cognizant. And I can tell you that the amount of time I spend with the patient or with the patient's family can be about the same. But the response is, wow, you listen differently.
Yeah.
Whoa. And I mean, and I get that very, very frequently.
Right.
And just in a more, I think I come across, right? I
Yeah.
create to be more caring. Was I
Right.
caring before? I think so. I think I was, I
Right.
mean, I've always prided myself in being a darn good anesthesiologist and a very
Right.
good listener, et cetera, and a very good communicator. And there's so much more now.
Right. Yeah. It's a deeper connection. Patients feel it, right? They do
Deeper.
feel it. Yeah.
We do.
And the teams feel it. And
Yeah.
we can't exclude that. All of our teams feel
Yeah.
it when we show up differently.
Yeah. Well,
When we show up,
the
you go
word I
ahead.
would put is contagious.
Yes, it is contagious.
And
Absolutely.
and the positive is just as contagious as the negative.
Hmm.
And I've seen that through organizations where the complaining and the
Yeah,
complaining, it becomes a contagion, right? Becomes
absolutely.
that can become a norm. And just switching that switch, just to where it's no longer a norm. And in
Hmm.
fact, it just sounds, oh, like why would you complain about that? Because look at this, and like this is where
Yeah,
you're empowered to have this change, even if it's just to think about something differently.
absolutely. Yeah. Yeah. Jeff spends a lot of time with his teams showing up differently and creating a different contagion in his OR. I know he does that. And it's, you feel it. You just feel the shift in the room. You feel the shift in the patient care when people are moving that energy, that contagion across the room. It makes a huge difference in patient care. Right, Jeff?
Absolutely. I agree with that. I like how you said when you're walking into work, you get to choose
Mhm.
Yes.
the versus not choose. And it seems like not choose would be experiencing oneself as a victim versus the author of their own reality or their own life. So sometimes it's been my experience when I express to someone, basically you could choose how you showed up and create your own experience. A lot of times people don't even think that's possible. They're like, no, what's happening around me, it makes sense for me to be upset. It makes sense for me to feel like a victim. How do you crack them open so you can see the possibility to choose?
Yeah.
Yeah, that's the tricky one, isn't it? Because that's something that we've ingrained. And I used to behave that way where, in fact, that was, the more you like join forces and complain, right? Or to fight against what needs to be changed. That's, was a show of strength or power. It's not effective.
Yeah.
It's not effective because leadership, whatever higher levels, not listening or doesn't listen to that. It's just not effective for yourself, your own personal health, or for others. And to help people to see that is, I think, by example is the best way. And
Yeah.
when experiencing it, and when they experience it, hey, if they approach a colleague in a different way, just maybe with a simple request, but from a different place, and they get a different response, that's how we all learn by experiences, right? Because
Right.
that's another aspect of this too, is that, and how I asked me earlier, Corey, how I work with folks, is organizations have spent millions, if not billions of dollars on leadership trainings.
Yes.
Training after training. We should all be excellent leaders by now. But I know my own experience is that I've had, the training I had, but then and it's like, oh yeah, this is great. This is wonderful. I know, the 7 steps to do, how to communicate, how to listen. And then I go to work. How do I apply this?
Right. Yeah.
And so that's where the being comes in, is taking all those things we knew, and excellent. I'm not slamming leadership trainings in any way, shape, or form. Great principles. Right. However, how valuable are they if we can't actually apply them?
Right.
And that comes down to an individual choice, and not just choice of like, do I choose to do this or that, but a choice of being able to show up and be able to interact with other people in a way that allows for me to apply the leadership skills that I've learned. It goes to that head up again.
Yeah, that's amazing. That's great. That's awesome. I'd love to shift us a little bit into some conversation around what your coaching and your work with physicians and leadership. And talking to you previously, I know that you understand that there's a lot of leadership from scarcity versus abundance. Talk a little bit about what that looks like for you in that space.
Yeah, I personally think it's gotten worse in the last couple of years, and also as people look forward of the unknown and the uncertainty, I think that feeling of scarcity is actually getting worse, right?
Yeah.
Because that coming from that, where, are we going to have jobs? I think it's an opportunity, right?
Yeah.
In that, boy, if technology can help me we've seen over the years, right? If technology can do something better and more efficiently, then that frees me up to do the human stuff.
Right.
I see this. I've been called sanguine before. So, it's not about being rose-colored glasses. I don't think it's about, okay, how can the new technologies, whatever they may be, free me up to do something that's even more human?
Yeah.
Along those lines, though, even with the pressures, just say for today, let's not talk about the future, right? Just the scarcity of today, the workforce, our workforce, we're all struggling, whether it's physicians, nurses, pharmacists, respiratory therapists, you name it, you name the role, there are workforce issues in most places.
Right. Absolutely.
There's also, compensation, reimbursement issues, concerns, some things that really are beyond, as an individual, they're beyond our control.
Sure.
However, how can I let my happiness, the question I have for myself is, how can I let my happiness and my joy and my life be negative because of things that are just beyond any one person's control?
Sure.
And that's the message I'd like to get to my colleagues and to my clients.
Yeah. What is your approach, or do you have an approach for how you get them to see how to create it differently, how to move from scarcity to abundance, how to move into a space where they're creating their future versus kind of what Jeff mentioned before, kind of walking in with a victim mentality? How do we move them from scarcity to abundance, to creation, to I want this to be different, and this is how I might do that?
Yeah. So I think the number one thing is that no two people have the same concerns.
Sure.
So I would say my number one tool is curiosity.
Yeah.
Curiosity and listening, and meeting the person where they are.
Absolutely.
And therefore, so help, it's very bespoke. So it's not not like having, I would say, have kind of a menu as opposed to here, this is step 1, this is step 2, this is step 3.
Yeah.
And it's not about helping the person to, yes, there's maybe some learning, some vocabulary, but helping them see what they already have.
Sure.
And taking them from where they are to where they'd like to be. Not where I want to be, but where they'd like to be, and where they'd like to go to, what they'd like to accomplish, what they'd like to experience in their life.
Yeah.
I really like working with teams, whether it's a leadership team retreat or organization, whatever size, the number of people in the room, because in our organizations, almost all organizations, I call it the unit of action.
Yeah.
The team. In that when we want to get a project done or we want to do something, we do it as a team. At our operating rooms, right? Our best days, our best patient care happens when we're all coordinated as a team.
Absolutely.
It even happens, in the C-suite, right? People need to be on board and working in the same direction. Absolutely. So having those conversations, and so that, as an example, if you just have one person who really changes, and they can be a contagion.
Absolutely.
And if you help the team grow together and find how they want to be as a team, and help them to see what's holding them back, what fears are holding them back, what skill, we often look to what skills are needed. Okay, add more skills. And perhaps there are sometimes it's skills, sometimes relationship issues. Sometimes it's that elephant in the room that nobody sees at all.
Yeah.
Or that perspective of, I mentioned before, we tried that and it didn't work. Sure. That'll never work. Those kind of things, like, well, what won't ever work? If the goal is big, if the goal is important enough, you'll find a way.
Yeah. I love that. Yeah.
And that's what I like to help teams do and individuals do. I think that probably sums it up pretty nicely too, is to figure out what that goal is and then find a way.
Find a way to get there. Yeah. Yeah. We experience that. And when you work with leaders, when you work with groups, what outcomes, you started this conversation off with quality, right? Some quality metrics, quality things. How is the being, who you are being, ultimately from a leadership standpoint? If people have an understanding of showing up differently, being different, what does that translate to from a quality standpoint, from an administrator standpoint? What do they see? What would they see when they looked at the work of being in medicine and showing up to differently? What would that look like?
Yeah, great question. I'm glad you asked that, Corey. Ultimately, and this may sound big, but ultimately, and I think you and Jeff have experienced in your practice, is competitive advantage.
Yeah. Yeah. It totally is.
Because I mentioned to you before that, I mentioned before about how, the workforce issues.
Yeah.
People want to work at places with a good culture.
Absolutely.
And Jeff, like you're saying, it's a choice, right? So it's our choice to create our culture, not just a choice of how I behave, but it's a choice then becomes a choice of that leadership team, becomes a choice of each individual to create the culture. Because I create my culture. I create my culture for myself, but I create my culture in wherever I go, right? In your
domain, in your world.
I'm working in, right, in the world, right? Yeah. And in the hospital space, it's whoever I'm encountering, I'm contributing, I should say, and creating that, as well as creating that culture, right? But I'm contributing to others. Yeah. And that's what organizations can experience, is that competitive advantage, which leads to retention, recruitment. Yes. And there are people who are happy in their jobs. Guess what we do when we're happy in our jobs? We don't just stay. We work more efficiently. We work more collaboratively. And going back to our FCOTS, right? It's not about looking to see, okay, why the patient wasn't in that OR at 7:30, because I've rarely worked in a system. I don't know if I've ever worked in a system where 5 minutes late, blew the whole bottom line, right? Right. But you have people who are working on a coordinated team who then result in patients being the metrics being met, the quality metrics being met, guess what happens in the line?
Right. Exactly. Yeah.
Let me ask you another question. Do you mind?
I was just going to say,
Hop in.
Jeff and I talk often about a culture of intention versus a culture of default, right? And we get too comfortable living in a culture of default, just letting it be what it be without intentionally creating it around us. And when we intentionally create that culture around us, then we drive so much more performance that leads to good patient experience, good patient outcome, more efficiency in the system, better culture, all those things. So Jeff and I spent a fair amount of time talking about that. So Jeff, maybe you can elaborate more, Jeff, on.
Well, that actually leads into my question.
Oh, good.
So the question is like, how does an intentional way of being, creating a culture, have an impact? And you gave some great examples about competitive advantages. And as the patient's experience, or the co-creators of their own experience, when we and our whole team shows up a different way for our patients, how have you experienced that changing patients' outcomes, their experience, their actual patient-reported outcomes, and actually by their co-participation in their care, tangible objective reduction and complications?
I don't have the data on that, but it's certainly, other than the correlated data of Press-Ganey, that the patient outcomes correlated to institutions with higher satisfaction scores of their staff and employees, the physicians, the practitioners. It just makes sense. I also I'm not in a position to really see patient outcomes. That's one of the limitations of my role.
Sure.
As I see patients in the very acute phase. Yeah. And that's that curiosity gap in my profession, right? Is that it's always wonderful when I get to hear from somebody like, oh, that patient who's like, oh, really, we didn't think we was going to make it, and then walked out of the hospital days later or whatever. Those kind of things. So as far as outcomes, I don't have personally. You probably do. You guys may have, but I don't have personal outcomes of that now, other than the more immediate, I suppose you might say, of the provider satisfaction.
Yeah.
But provider satisfaction, there is good data support that provider satisfaction, and I use that term, just as a broad term, has been related to improve patient outcomes and patient satisfaction.
Absolutely. Yeah. Yeah. We've talked a lot actually about choosing your own experience, choosing your own way of showing up, right? Choice is really important here. One of the things that is also important, we look at it as a three-legged stool: the patient experience, the team member experience, and the provider or clinician experience, right? If speaking to the clinicians here, what would you say to them to help them create that curiosity?
Oh, I would say to look at what they think is too big for them to change.
Yeah.
Not be overwhelmed by it. And see what little change, what impact they could make, and maybe just play around with it. Just go into work someday and say, you know what, in your own head, this may sound a little hokey, okay, but it doesn't have to be like, you know what, I'm just going to love everybody in this room today. And nobody around here is going to do anything that's going to get on my nerves, right? I'm just going to be like, oh my goodness, that is like the perfect thing. That's the perfect thing. That's the perfect thing. As opposed to going in and looking for, what they do now, right? What they do, right? Yeah. And I've gone to work with both attitudes. So I can, I'm not, this is not a stone from a glass house here at all. But to go and see how people respond differently, and beyond the whole, like, okay, we're being helpful team members, but really, truly, just embrace that. Wow, nothing's gonna flat me today. And I'm just going to, whatever they do is going to be that perfect thing to do. And that to me just changes an experience.
Yeah, absolutely. Jeff, you have any follow-up on that?
No, that was fantastic. Thank you for asking.
That's awesome. So when I really want to get back to, how did you find yourself in the space of being, and being incredible is your business that you run, right? So how did you find yourself coming into that space?
So yeah, in some ways I have to say I don't know, because I actually named my business
Yeah.
before I ran into the being aspect and the terminology of being.
Yeah. That's
So
amazing.
there's only one word I have for that, and that's inspired.
Yeah. Yeah.
Because it's become more meaningful since then. Why did I name it? Why did I name it? What was my thought process around it? Is I recognized that for years, decades, I and others have been trying to do things, and that doing and what sort of prompted me to pull away from the practice, full-time practice, was that we were doing and doing and doing, but something was not right. And I recognized that one thing that was missing was credibility. I
Yeah.
thought,
Sure.
in my judgment, it was credibility. And I sort of in my heart decided, and this is what prompted the name, was that more important than doing important things, doing things that were, meeting audacious goals, becoming a full professor, whatever title, whatever role, was
Yeah.
rather than more important, there wasn't as much value in doing important things unless it came from a point of being credible and being in your credibility. So that's where that comes from. Where did I come around and learn about, being and all the history that leads into that, that the philosophy behind that and all really was meeting people, hearing people, interacting with folks as I, came out. I'm going to learn how to coach. I've done that. How many training programs? I've learned, 2 team coaching training programs. So I went through the whole, what I'm supposed to do, right?
Yeah.
What I'm supposed to do. And I checked those boxes as well. Very helpful.
Yeah.
That's been very helpful. And fortunately along the way, when the training programs I went through taught me how that in order my result was based on my actions. And I was used to being in that loop. I want a different result. What do I do? What am I taught to do? To take a different action.
Right.
Whereas really, if I take that step back and
Mhm.
where am I coming from? What's my credibility that I need to be in? Who do I need to be? What choice do I need to make in order to take that action?
Yeah.
And a lot of it I recognize too, depend on my perspective. My perspective changed too, right? From being a full-time physician and full-time academics, I could take that step back and then take a different look at a different pivot.
Yeah.
And that's always been available to me.
That's always been there. Yeah.
Yeah, it's always been there. And that goes back to my PhD days, right? Of,
Yeah.
always taking, I say the good science, if you get one answer, good science leads you to asking 10 more questions, good questions.
Absolutely.
And that's where I think, having that perspective to be like, what perspective, there's another thing I like to talk about, Jeff, is that, and Corey, is that your perspective, where your perspective is, who you're being is your very first choice.
Yeah.
That then influences your actions and influences your result.
Yeah. Yeah. The tagline for being in medicine for us is always there, always happening. It's always been there. Who you are being has always been there, and it's always happening.
Yeah.
Whether you realize it or not, your being is something is happening around you based on who you are being in that moment. Right. Jeff.
Yeah. And even when you described, how you said that, action produces outcomes, but effectively who we're being creates our actions. Going back to what you said a minute ago, as a thought experiment, to somebody who had the curiosity to maybe do it, go into the room thinking, I'm just going to love everybody in this room. And whatever choice they make or action they take is the right action in this moment. That's more than just a doing, that's a being. I'm going to show up being love. I'm going to show up being non-judgment. And yeah, it's brilliant. Love it.
Yeah. Yeah. That's fantastic. So tell us a little bit about how people get a hold of you, how people contact you. How do they work with you?
Yeah, the best thing to do is just drop me an email, or my website has a contact to my calendar, but just drop me an email is probably the most efficient way. And that's simple. There's a dash in there that's a little complicated, but it's Cathleen with a C. That's my parents named me. They named me Kathleen with a C at being-incredible.com. And that's the easiest way.
That's fantastic. And the website is the same thing, right? Being-incredible.com.
It is.
That's awesome.
Yeah.
Thanks for sharing that. I know there'll be listeners who want to reach out and learn from you, take your wisdom and apply it everywhere. So thanks for sharing that. One thing before we move on and so forth is, if you were to speak to the clinicians of the world, or if you were to speak to patients or the team members, right? What would you say? What superpower would you want them to have around being in medicine? What would that be?
That you don't have to change the world in order to change your world.
Yeah.
Oh,
That you
that's
don't have to.
wonderful.
Because, the whole, healthcare systems, they're big, they're bulky, they're maybe not optimized, but that doesn't mean that my world, each and every day, my life has to be impacted negatively. And so it's not as heavy as it feels. I guess it'd be too.
Yeah. It's much lighter than that, right? I mean, it's a shift in your mindset. It's a shift in who you're being that will change your world. Whether or not the system around you changes or not, it is a personal choice to make that change within you, right?
Yeah. And who knows? You mentioned about outcomes. Who knows what how the system might change if we were to?
Yeah, which is what we're here talking about, right? Create
That's
awareness, create curiosity for people to understand that that shift can transform medicine. Right. If you were to look into the future and see what would transform medicine, where does this fit in?
Yeah, this fits into every aspect from training, right? Is to making people aware of who they are and how that impacts how they're seeing what's possible and not possible.
Yeah.
So even making those decisions around, what educational path to choose. Something I've done a few times now, what job to take, right? But also just how on those every day that we have at any moment in time, we get to choose how we're being and, reflect back and go, oh, that, we talk about reflective practice. In some ways, that's what we're talking about, but we often talk about actions, look at actions in our reflective practice to say, okay, what could I have been done better in that case, right? How could I have done that differently? How could that conversation have gone more effectively? Incorporating that into who we're being.
Yeah.
To include, if not even to include, but possibly to start there. Who was I when I went into that conversation? Who could I create myself to be next time when I have a similar circumstance?
Yeah.
So
I'm glad you brought up
I'm sorry.
Yeah. No, I was just saying, I'm glad you brought up the training because you're a professor. You've taught all over the place, right? I can't even name all the places that you've been engaged around training and building curriculum and helping students. Where would you get into this with students, with training? Where would the introduction to this? What would that look like?
Oh my goodness. Optimally?
Yeah. Let's think big.
Let's think big. I think when we start forming personalities, that's where it needs to be.
Yeah.
You want me to think big, Corey?
Yeah. Well, as soon as we recognize
beginning.
that something is mine, that's when we need to start to understand, right?
Yeah.
Yeah.
Yeah. It's like helping. Yeah. I'm always encouraged when I see young people engaging in this kind of learnings and teachings, because that's where it really, the sooner we learn it, the better.
Yeah.
Because I think it allows us, we talk about self-empowerment, we talk about self-esteem, we talk about confidence, we talk about that once you recognize that you have a choice of who you're being, all those are just results.
Yeah, absolutely. Yeah, that's great. So how, obviously you've worked with med students, with residents, with folks in your practice. How do you engage with them differently now? What kind of wisdom do you pass on to them?
Yeah, I don't have that. That's the one downside of having stepped away.
Yeah.
Is I don't have the access to the learners so much right now. But I do have my coworkers. I work primarily with nurse anesthetists as far as on my team, on my direct team, but then also my, the proceduralists, the surgeons, et cetera, and nurses and circulator nurses and PAs, et cetera. I would say most impactfully by modeling the best I can.
Sure. Yeah.
So I think in one way, so one philosophy I came up with is not sort of boom, but it's sort of a tangential is um, Dory from Nemo.
Yeah. Absolutely.
So Dory is the character, for those who may not know, Dory is the character who in Finding Nemo helps Nemo to find his dad. And Dory is not maybe taken to be the smartest person, but there's some qualities of Dory that I think are just, we need to embody. And Dory is one who, wherever she goes to, she's happy to be there.
Right.
And she's forgotten everywhere she's been.
Right.
No history of the past, but she's happy to be there.
Yeah.
So what I've done as my teens is I actually wear Dory on my lanyard.
Oh, wow.
And if something gets tight, I have a Dory, I don't know, whatever the GIF or whatever the video of Dory that I'll text to people, right?
Yeah.
So if things are getting kind of like, sometimes we get into a spiral of hurry up and wait. We're ready, but who's ready, but who's like, and so sometimes it can get kind of frustrating.
Yeah.
Be Dory. We
Right.
are going to be Dory.
Yeah.
And I'll send that gift, and it always gets a chuckle that the nurses know about it, kind of thing.
Yeah.
And so when I show up, and it's just like I'll just hold my lanyard up. It's like we're going to be Dory. We are going to arrive. If we've been an hour and a half waiting, and maybe somebody we think this person, we don't know what else is going on, perhaps, or
Right.
even if they did, go have an extended lunch and we were set waiting, whatever it is.
Yeah.
We're here for the patient. We're here now. We're not. That's behind. So we're going to be Dory. And that's my, without using any terminology or fancy thing. And people have really embraced that.
Oh, that's wonderful. That's great. I'm going to use that. Yeah. Jeff, what do you have to say about all that?
Going back to the reflective process on who was I being.
Yeah.
Yeah. And then adding in what you talked about, if we could have access to the ideal point in time, it would be clear back when the personalities were starting to be formed. And as Corey said, when we see something as mine, right?
Mm.
Well, if we grew up from some number of decades living a personality that we might be responsible for, but we didn't consciously choose, and it's had an impact on who we're being without us even realizing it, then when we look back reflectively, like, who was I being in that moment and how might I have been otherwise? I think it's useful to apply non-judgment, to apply forgiveness. Like in that moment, based on the thoughts that were available to me, I was doing my best, and now I see something different. What are your thoughts on that?
I think that's brilliant. I think that I'm glad you made that point, because it's not about being judgmental, right? It's like, especially, when I look back on, been many decades now, and I look back at, my childhood, I was taught things the best my parents, my teachers, my influencers knew to teach me, which makes me to this day who I am. And I value that. Some of the things I was taught teaches, maybe I have to kind of shift around, like, is that really true? Or is that the best thought for me today going forward? I'm very fortunate. I'm very, very happy. I got a good draw on the lottery of parents. So I have to say, that said, it's like looking back, I think you're right. It's with love. It's always with love, and even to myself in those circumstances, and learning from that. But yes, loving who I was at that time, and those days when I walked in and wanted to go home after 15 minutes, what was I thinking, right? And not even like, what was I thinking? Oh my goodness, how you do think? But like, what was it about that? What is it about that? To notice that and like, okay, how can I be different now?
Yeah.
And create it now.
Love that.
Yeah, that's great.
Choose again.
Choose again. Oh, I love that. Choose again. Yeah.
Yeah. Every moment, right? One thing about Dory in the movie, which my children love, is she's so present, just present to the moment, right? Present to what's in front of her. What role does presence play in your world, in your practice, in your healthcare experience?
I think that's fundamental. I think you have to be present to be curious. You have to be present to listen. You have to be present to be aware of around you. You have to be present with yourself to know, to make that choice. I think presence, I'm glad you said that word, Corey, because it's absolutely fundamental. You have to be present at all times, and present to then that option to make a different choice.
Yeah. And presence and going along with being a good listener, those are things that we do teach students. We do build into curriculums how to, the techniques to be present to listening to your patient, listening to what's in front of you, right? So people have been introduced to what being in medicine is. We just haven't formulated the language around it to really help them express that this is something that comes from you. This is you in the moment in medicine. This is who you can be.
Well, I was thinking about the other day that I think we've attempted to, and we've labeled it as professionalism.
Oh, that's great.
Professionalism is one of those things where I've heard described it, it's like the old, that you know it when you see it.
Yeah.
Right. Because even when, we in the part of the board certification exam in anesthesiology, I've actually chaired the committee that created the exam that assesses professionalism, communication professionalism, as part of our board certification process.
Yeah.
And it's like that whole, what's professionalism, right? But you know it when you see it. And it was sort of that light bulb moment a couple of days ago. I'm like, it's being.
Right.
We are actually assessing how the candidate in that circumstance is being. So professionalism in our clinical arena, we're coming. I'm going to be professional. Well, I'm going to create myself to. How am I creating myself to be professional? What does that mean, right? Yeah. So I think that's the word that we've used is kind of that we don't know what it is, we don't know how to say it, but it really comes down to being.
Yeah. That's fantastic. I love that. I never thought about it that way, particularly. So that's really valuable. I hope everyone listening heard that.
Brilliant techniques. Yeah. Techniques to occur as present and techniques to occur as a good listener are still doings. Yeah. And what Corey and I say is the best way to occur for our patients as compassionate is to actually be compassionate.
Be compassionate.
Yeah. Yeah.
And I think our first step for many of our leaders now is to be compassionate to yourself.
Mm-hmm.
We have to be compassionate. We have to be loving to ourselves first. And I believe first, in order to know what it is to be compassionate, to be able to be sincerely compassionate, with credibility, compassionate to our patients and to our colleagues.
Yeah. Yeah. Patients, colleagues, team members, they feel it, right? They just feel who you're being, and all of them. And we as clinicians and we as folks in this world feel what other people are being, right? And and we can move that energy around and shift that in that space around us, for sure.
Yeah. In the communication space, you guys have probably gone through the team steps and the training and how to be, and it's all again about the actions, right?
Yeah.
And how to listen, how to do the 2-step, call back, and how to stop the line and everything. But it really comes down to all that becomes easy. Yes, having the same vocabulary, brilliant, right?
Yeah.
But all that becomes easy to speak truth to power when you're being sincere, when you're being loving, when you're being gratitude, when you're being choosing who you need to be in order to take that action.
Yeah, absolutely. Yeah. Being authentic to who you really are. Right. And so sometimes in medicine, it feels as though we lose some authenticity of ourselves when we're in that rigmarole of that, that daily grind, and we're moving and actions and doing. And then our authentic selves aren't showing up the way that would really transform our experience. And so it's being authentic, being love, being forgiveness, being kindness, being the things that generally led people to medicine in the first place, right? Wow. Really connecting back to the purpose of why we got into this profession to begin with, which was to usually help and serve others, most folks, I would say, right? And how do we be authentic to that and show up every day for our way of being in medicine? Yeah.
And I think that goes back to one of the outcomes, I believe, is that we can recapture that joy, to remember that as you wrote that personal statement, to apply for whatever program you're applying to, whether it's PA school, pharmacy school, medical school. And like, nobody said, oh, I want to be, tired and run down and feel overwhelmed and, beaten by a system that's going to be so much bigger than me. Nobody says that. They want joy and they want to make a difference and an impact in this world. And I think that's,
as a possibility, joy is always already there.
Yeah.
It's just being covered up by the things that aren't joy. So get rid of those things.
Get rid of those.
Yeah, absolutely. Yeah. What else, Kathleen, would you want our listeners to know? What pieces of gold, what glimmers of knowledge or wisdom do you think we haven't turned over yet in this talk, in this conversation?
I think the important thing to know is that, some people might think, oh, this is, it wouldn't apply to me, or it sounds so Pollyanna, oh boy, like what, right? It's just like, it's not, you don't know my hospital. You don't know where I work. Right.
Yeah.
And no, I don't. We don't. But I think, I've worked in some pretty high pressure, high acuity situations. And there's so much more available when we slow down and we recognize that there are options. And I would say what I would encourage people to do is to consider what their barriers are, what it is their goals are, whether it's as an individual, whether it's a team, whether it's an organization, an entire institution. What are those goals that they'd like to meet that they're not meeting now? And maybe it's something interval. Maybe it's, how their team responds. Let's say, talking to a leader not too long ago who frustrated over how the faculty responded to change. Well, what could be done to have those faculty, that might not be an end goal, right? But that interval, what could be possible if you just change that?
Yeah.
What other goals what goals could become possible if that were changed? And so I think that's the end message, or one of my final things is that there are a lot of opportunities out there and a lot of possibilities out there. Yeah. And it all starts, the root of it is who we choose to be.
Yeah. Yeah. No matter the hospital, the clinic, the system, right? Those things, as we talked about earlier, right? Those things may or may not change or transform over, those are big systems. Those are big things, but it starts with each one of us individually, choosing who we are being, choosing how we're showing up, and choosing to create our own experience in medicine, because we can create the world around us. We create that for ourselves. And there's ways to do that will transform your experience of medicine individually.
Yeah. And you mentioned the default future.
Yeah.
The default, right? It's like, who does it help? If this seems too good to be true, because it's not, but if it should, what's the alternative? What's the default? Who is it helping? How is it changing the system or helping on any level to just be, feel pressed, to remain in a place of feeling disempowered?
Right. Yeah. Choosing to take back that creative power of your own life, of your own experience. That's where it starts, right?
Right.
Transform. Right. Absolutely.
Yeah.
Jeff, what are your thoughts on all that? Any wisdom there?
I think it's amazing. I really appreciate your time. And I love how you describe the default future. And when it comes to medicine, it's like a gigantic ocean liner heading across the ocean, and we could plot a course and know where it's going to end up. And to use Buckminster Fuller's analogy, we can just be the trim tab, and maybe by making a tiny little shift on the trim tab, it'll make a move in the rudder, which will change the direction of that ship to where we'd want it to end up.
Yeah,
absolutely.
So thank you for what you're doing.
Thank you. If we don't try, it won't happen.
Yeah, that's right. Right. Well, show up and choose to transform medicine through our own state of being and who we are being, right, in medicine. Yes. So, Dr. Cathleen Peterson-Layne, thank you for joining us today. Thank you for sharing all your wisdom with our listeners and with us. I learned so much every time I get to spend some time with you. So, for those listeners who want to engage with Dr. Kathleen, go to being being-incredible.com, right? Hyphen,
That's it.
being-incredible.com. Get to know her, get to take her wisdom, take it all in. We're just lucky and thankful that you chose to join us, and we love to have you back anytime because you're brilliant.
Well, thank you so much for having me, and thank you for what you're doing in this world to move that ship.
Well, we appreciate that and acknowledge for all the work that you do. And I just want to acknowledge you for doing all, you spent a life of performing actions and stepping back and taking in your being and how that is going to transform all of the teams that you work with, the leadership you work with, your colleagues, and your patients. And that just is wonderful to hear. And I just want to acknowledge you for the work that you've put in to do that. So
thank you so much. It's a joy. It really is a joy.
Excellent. All right, listeners, we'll come back next time and we'll spend some more time diving into being in medicine. And once again, thanks, Jeff, for being part of the conversation. And thanks, Dr. Cathleen, for being here. And we look forward to future conversations.
Thank you for joining us today on the Being in Medicine show, where each week we open the transformative power of connecting our physical, emotional, mental, and spiritual nature to how we show up in medicine.
If you find this conversation valuable, please like, comment, and subscribe. And if you or someone you know has a story to share, contact us at beinginmedicine.com. See you next time.